Hello, my name is Lauren Distad, and my research is on neuromuscular profiles and load monitoring in collegiate volleyball athletes. Here is the outline for my talk today. To begin with college athletics, 75% of athletes will experience a musculoskeletal injury over the 4-year collegiate career. The cause of these injuries include lost playing time, potential increase in games lost, and long-lasting effects of injury to the quality of life. So why study volleyball? Volleyball athletes experience the highest jump load out of any sport and report the highest rates of chronic knee pain. Injuries have been seen to relate to the amount of work done. Load monitoring of athletes has become quite common. It's done throughout all phases of training, including preseason, in-season, and off-season. For the current study, we have chosen to study preseason as it is a 3-week period of high-intensity training. External load, seen on the right side, is a physical load completed by the athlete. Internal load, seen on the left side, is how well the body responds to that load. For our study, we will be determining external load through the use of vert jump tracker and internal load through the use of ultrasound measurements of the distal patellar tendon. The purpose of this study was to investigate the relationship between elevated landings and the distal patellar tendon thickness during a women's collegiate volleyball preseason to explore how jump load can affect the soft tissue composition of the knee. The study included 17 NCAA Division I collegiate volleyball athletes at George Mason over the course of a 3-week preseason with daily and weekly assessments. The first assessment tool we used was VERT, an inertial measurement unit, or IMU, tracker at every practice session. It evaluated the number of elevated landings, which is when an athlete's landing force exceeds 15 Gs. The second is ultrasound measurements. We used the Clarius ultrasound to obtain weekly measurements of right and left distal patellar tendon thickness 3 times to obtain an average measurement. We further evaluated using VERT and ultrasound data ran through our software. We started with the residual analysis, a Shapiro-Wilks test which showed a normal distribution, then went on to repeated measures correlation between the number of elevated landings and the left distal patellar tendon thickness, which was insignificant and showed that the number of elevated landings is not a strong predictor of overall left distal average patellar tendon thickness. Moved on to a linear model with athlete effects, which showed that 4 athletes had statistically significant p-values and showed that the correlation between the left distal patellar tendon thickness and the number of elevated landings in the preseason was significant. Overall, the model had a strong fit and is statistically significant. This figure shows the relationship between the number of elevated landings in the preseason and the left distal patellar tendon thickness for all 17 athletes, of which only 4 showed statistical significance. The results suggest that we need to look at athlete-specific effects. This is because only 4 out of the 17 athletes showed a significance in the correlation between the number of elevated landings in the preseason and their left distal patellar tendon thickness. Additional factors that could be explored include training history, physical condition, performance in a specific setting, and especially academic class, as the 4 significant athletes were all freshmen. Here are my acknowledgments and my resources. Thank you for your time and thank you for listening. Go Patriots!